Good day to you, Ma'am Celine and Sir Astakaan. This will be my written demonstration of the different routine projections of the shoulder, namely the AP and the posterior oblique or the Grachi method. So, ang first is ang AP. It consists of three different rotations, which is the internal, external, and the neutral. So, in the later parts of the video, I will show all of those rotations. And then, the minimum SID that I'll be using is 40 inches with an IR size of 10 by 12 inches. And my technical factors in sa KVP is 70 to 85 KVP. I will also be using a grid. Good morning, sir. Tuloy lang, sir. Tuloy lang po. Welcome to the facility, sir. So, ako po ang RadTech po today. In charge. Ako po si Saud Dataya, sir. So, first, sir, bago tayo proceed is, ang name nyo po, paki-state number.
Muhammad Said Dataya.
Muhammad Said Dataya, and ang age?
19 years old.
Ang birth date?
October 31.
October 31. Okay. So, ang procedure po na ni-request dito, sir, is shoulder.
Opo.
So, bakit po yun, sir? Anong is the chief complete?
Bigla lang po siguro sa pag-stretch.
Pag-stretching.
Na po. Opo.
Okay. So, mga ilang days na ba yun, sir? Weeks or months? Matagal na po?
3 days po, bago na.
3 days. Okay. So, bago tayo proceed, sir, bibigyan ko po kayo ng shield. As always, dyan po yan sa baba ng waist. Gonadal shielding po ang tawag dyan. So, suotin nyo lang po yan throughout the procedure. So, the first projection I'll be showing is the AP, external rotation. So, bago tayo ma-proceed dun sa part position, sa patient position muna tayo. So, the patient is lying flatly against the IR. And the patient is erect. Ang explanation kung bakit mas preferred ang erect kaysa sa supine is it provides less pain or discomfort sa patient. Lalo na if may injury. Kasi hindi siya masyado in contact. Hindi siya against sa gravity compared kung mag-supine or hihiga ang patient. So, make sure that the shoulder is in contact against the IR. Pwede natin pa-rotate minimally ang patient para makakomply dito. And so, ang first projection natin is ang AP external rotation. External rotation, so, instruct natin ang patient to externally rotate the hand. So, you can get a AP external rotation projection of the limb. To ensure na proper ang pag-rotate natin, make sure that this line, the epicondylar line of the humerus is parallel against the IR. So, medyo rotated pa siya. Rotate ka dito banda, sir, pag ganyan. So, contact pa rin. Make sure also din pala ang kamay is abducted, meaning moving away from the midline of the body. Slight lang siya na abduction. So, parallel na siya. Aligned na siya sa IR. So, assuming na nalagay ko na itong IR and ang corresponding na marker dito sa may image receptor natin since gagamit tayo ng grid. So, bago tayo mag-proceed sa paglagay ng central ray, so the central ray should be directed towards the coracoid process. So, paano ba natin siya mapalpate? So, first, ang ginagawa ko is to palpate first the acromion process, which is dito banda, the acromial end of the clavicle. And then, after mapalpate, is direct inferiorly 1 to 2 inches below. And then, medially naman, 2 to 4 inches. Mga ganito dito banda. So, exactly dito banda ang coracoid process, which is inferior dito banda sa lateral end ng scapula or clavicle rather. So, after natin mapalpate yun, pwede na tayo ma-proceed sa central ray. So, ang coracoid process na palpate natin kanina dyan banda, exactly dito. So, ang central ray is directed 1.5 to 2 inches below the coracoid process. So, dito siya banda. Make sure to include the whole shoulder. Ganda ang pagkakolimate natin. Then, before proceeding with shooting the beam, make sure that the patient make sure that you instruct the patient to suspend respiration during exposure. So sir, sunod lang sa instruction sir. Inhale. Then, shoot the beam. Then you can now ask the patient to exhale. Exhale na po sir. So for the next projection is ang internal rotation. So same patient position pa rin, erect. And ask the patient to internally rotate the limb para makakuha tayo ng internal rotation of the shoulder. So dyan po banda sir. I-rest mo lang po dyan banda sa may lap mo. Make sure that the shoulder is placed flatly against the IR to decrease OID. May ensure natin na tamang pagka-rotate natin sa limb ng patient is dito siya banda. Itong interepicondylar line dito banda sa humerus. It should be perpendicular against the IR. So may konting rotation pa. Rotate ka po ganyan sir. Then dikit ang shoulder dito. So mas naging perpendicular na ang interepicondylar line dito banda sa humerus against the IR. So after ma-ensure ang position ng part of the patient, proceed naman tayo sa central ray. Same din. Inferior 1.5 centimeters against the coracoid process. Same din ang instruction is to suspend respiration during exposure. So, sir, inhale ka po muna sir. Inhale. Then you can shoot the beam. Okay na po sir, exhale na. So, ang last natin na rotation sa AP is the neutral rotation. So, there are cases na hindi natin talaga pwede ask ang patient na internally rotate or externally rotate ang limb dahil makakause tayo ng complications to further injuries. So, this position or projection is a trauma position. So, ipapakita ko dito. So, kunwari na lang na injured ang patient natin. Pero makakaya siya mag-stand up. So, erect ang position ng patient. So, neutral ang rotation. Meaning, ganito lang ang normal niya na orientation ng kamay. Hindi siya ma-internally rotate or externally rotate. Kaya siya tawag na neutral rotation. So, the shoulder still against the IR. And the epicondyles of the humerus are approximately 45 degrees against the plane of the IR. Makikita natin dito. Ito ang line niya. And dito banda ang IR. So, approximately mga 45 degrees ang orientation ng epicondyles. And so, after natin ma-ensure ang position of the part, and proceed with the central ray. So, the CR should be directed towards the mid-scapulohumeral joint. So, paano natin ito siya mahanap? So, kanina napalpate natin ang coracoid process ng patient. So, according to the book, it is slightly lateral against the coracoid process. So, dito siya slightly lateral dito and slightly inferior. So, balik tayo. Dito ang coracoid process, slightly lateral. I guess mga an inch or a half inch. Then, slightly inferior. So, dito banda, mid-scapulohumeral joint. So, before natin i-shoot ang beam, as always, is to suspend the patient's respiration during exposure. So, sir, proceed na tayo sa pag-shoot ng beam. Inhale po, sir. Inhale. Then, you can now shoot the beam. So, okay na po, sir. Pwede ka na mag-exhale. So, the last position I will demonstrate is the Grassi method, or more commonly known as the posterior oblique position. So, first is rotate the patient's body 35 to 45 degrees against the IR, ang affected part. So, upon rotation, is naka-neutral din ang rotation ng limb. And make sure that the shoulder is against the IR. Place flatly. Make sure din natin ang pagka-abduct ng arm. So, upon assessment of my patient, makikita natin na rounded ang shoulders niya. So, in these cases, we should increase the rotation of the body. Hindi lang siya 35 degrees, kundi as much as 45 degrees. So, ayan, naka-rotate na siya. 45 degrees exactly against the IR. So proceeding on with the central ray. Still, nakadirect siya sa may mid-scapulohumeral joint. Make sure to maintain the proper collimation dahil glenoid cavity ang focus dito sa position na ito. So medyo hindi lang klaro ang central ray ko, pero dito siya banda sa mid-scapulohumeral joint. And we will now proceed with the evaluation criteria for the shoulder and the different structures shown. So mauna tayo sa external rotation. So for the structure shown, this is the acromion and this is the coracoid process. This is the greater tubercle, the lesser tubercle, and this is the whole humeral head articulating within the glenoid cavity. As you can see here, that is the scapulohumeral joint. And you can also see a one half of the humerus. This is the proximal humerus. So for the evaluation criteria, paano ba natin malalaman na nakatamang rotation ng patient, kung tama ba ang full external rotation niya? So this is evidenced by this. Ito siya main factor dito na makadetermine kung tamang external rotation. This is the greater tubercle. Dapat dito siya banda ma-situate sa may lateral aspect ng humerus. So as you can see here, ito ang greater tubercle. And another factor is that the lesser tubercle is superimposed over the head of the humerus. So next tayo is the internal rotation. So mauna naman tayo sa structure shown. Ito ang coracoid process. This is the acromion and this is the acromial end of the clavicle. The humeral head. This is the greater tubercle and the lesser tubercle. Then makikita natin ang shaft na humerus, proximal humerus rather. So for the evaluation criteria nito, malalaman natin na internal rotation dahil ang main evidence dito is ang lesser tubercle naman ang nasisituate din the medial side banda ng humeral head, kasi since internal rotation, so dapat dito yan siya banda masituate ang lesser tubercle. Then ito naman ang greater tubercle, nasusuperimpose niya ang humeral head. So those are the factors na malalaman natin na naka-internal rotation ang patient. Then next up is the Grashy method. So for the Grashy method, the structure shown is the acromion, scapulohumeral joint, the glenoid cavity, the humeral head, the acromial end, the scapula. Ito ang coracoid process. So dito naman sa Grashy method, one thing na dapat natin i-note is that the scapulohumeral joint should be open. So dito makikita natin may konting space siya dito. So that is the reason na bakit ginagawa ang Grashy method, para makita natin ang interspace dito banda sa scapulohumeral joint. Kaya siya special method. So dito sa Grashy method, ang main focus dito is dapat hindi ma-superimpose ng humeral head ang buong glenoid cavity. And then lastly is the EP projection neutral rotation. So this is the acromion. Ito siya, medyo dark lang siya, hindi siya masyado maklaro. And this is is the coracoid process. The scapulohumeral joint. Medyo heavy ang superimposition na mahirap siya i-visualize. The greater tubercle and the lesser tubercle. Itong bump dito. Kita yung white. Yan ang buong scapula. Makita rin siya. The lateral aspect, middle aspect, may konting outline siya dito banda. Nasusuperimpose ng ribs. So itong neutral rotation, it is a trauma procedure. So kaya siya iniiwasan sa routine procedures is kasi ang tubercles is mostly superimposed by the humeral head. Kasi kailangan nila ng varying na mga rotation, internal or external, para maklaro ang mga tubercle. So kaya ito siya trauma position kasi you don't need the patient to move the hand or hindi na kailangan i-rotate. Pero ayun din sa radiographer, disadvantage din na mahirapan siya the radiologist rather, mahirapan siya i-identify, lalo na dito kung may fracture siguro, mas mahirap siya i-identify ang mga tubercles sa isa't isa.